I mean, we're very fortunate in anxiety disorders in having two major modes of treatment. There's pharmacological treatment and what could be called psychological treatment, although perhaps should be called psychotherapeutic treatment. And in general terms, they both work probably as well as each other in acute treatment and in longer term treatment. So people can be offered a choice of a drug treatment or a talking treatment. In terms of the combination, it does differ from disorder to disorder. So, for example, in patients with panic disorder, there's pretty good evidence that combining a drug treatment with a psychotherapeutic treatment is the optimal approach. The response rates are somewhat greater with combination treatment. For other conditions, it's less clear. For example, in generalized anxiety disorder, GAD, the evidence base doesn't really allow us to conclude that combination treatment is superior to either a drug treatment given alone or a psychological treatment given alone. In clinical practice, by the time patients are seeing a doctor, usually a combination approach is needed. Waiting lists for psychological treatment can be quite lengthy, so it's often the case that someone would start with a drug treatment, a medication, and at that point would be referred to a cognitive therapist, so that by the time the medication is beginning to have an effect, they could benefit most from the incorporation of a psychological treatment. But most patients would probably prefer the combination of a medication with a psychological treatment rather than medicine alone.